Okay, we're now looking at the heart from its anterior surface. So again, large part of the anterior heart is formed by the right ventricle. That's the right auricle right there. We have here the pulmonary trunk and the ascending aorta. So this groove in between the atrium and the ventricle, that is where we can find the right anterior coronary artery. But at this time, the artery is still covered by a thick deposit of fat, which is found right below the epicardium. So on this part, we can see the outline, although like the right coronary artery, it's partly obscured or covered by fat. You can see the outline of the anterior interventricular artery, or the anterior descending branch of the left coronary artery. So let me turn over the heart to its right side here. So right auricle once again. Now the superior vena cava is visible together with the inferior vena cava. Then okay, this groove right here, that groove right there, that is known as the sulcus terminalis. Sulcus terminalis. So if you look at this side of the sulcus, the right atrial wall appears smooth. But when you look at this part, where you have the auricle, it appears rough. So this vessels right here, these are the right pulmonary veins going into going into the left atrium. So vena cavae, superior and inferior, enter the right atrium. Then we have pulmonary veins entering the left atrium. So posterior side of the heart actually belongs mainly to the left atrium. You can see two pulmonary veins entering the right side. On the other side, there are supposed to be two pulmonary veins also entering the right atrium, but we cut very close to the atrial chamber here. So this part of the left atrium is partly damaged, and we cannot anymore distinguish the two veins that are supposed to enter the left side of the left atrium. So this is the auricle of the left atrium. We have the pulmonary trunk once again right there. So in this area, this is where in this area we can trace the origin of the anterior interventricular or anterior descending artery, as it comes from the left main coronary artery. So this groove in between, by the way, this right here is wall of the left ventricle, and this groove right between the left atrium and left ventricle, that is mainly occupied by a large large vein, the main venous drainage for blood coming from the myocardium, and that vein is called the coronary sinus. So the apex of the heart is right here. Actually, we can describe the heart as a cone-shaped organ. So this is the apex of the cone, and the base of the cone is right here where the great vessels arise.